Assalamu alaikum students, welcome back to my channel. Today we are exploring stroke. So without any further delay, let's start the video. A stroke occurs when the blood supply to a certain part of the brain is reduced or interrupted. Without oxygen and nutrients from the blood, brain cells cannot function properly and eventually die. There are two major types of strokes: ischemic stroke and hemorrhagic stroke. The ischemic stroke caused by a blocked artery. Ischemic stroke happens when a blood clot obstructs an artery. In some patients, the clots form locally inside the blood vessels that supply the brain. This occurs when fat deposits in an artery or cholesterol plaque rupture and trigger blood clotting. In other cases, a clot may travel to the brain from elsewhere in the body. Most commonly, this happens in the patients with arterial fibrillation, a heart condition in which the heart does not pump properly. Blood stagnates in its chambers and it facilitates blood clotting. The clot may then pass into the bloodstreams, get stuck in the small arteries of the brain, and then block them. Second one is hemorrhagic stroke. Hemorrhagic stroke caused by leak or ruptured artery. This can result from high blood pressure, overuse of blood thinners, anticoagulant drugs, or abnormal formation of blood vessels such as aneurysms and AVS. As hemorrhage takes place, brain tissues located beyond the site of bleeding are deprived of blood supply. Bleeding also induces contraction of blood vessels, narrowing them and thus further limiting blood flow. Stroke symptoms may include one or more of the following: paralysis of muscles of face, arms or legs, inability to smile, raise an arm or difficulty walking, slurred speech or inability to understand simple speech, sudden and severe headache, vomiting, dizziness or reduced consciousness. Cerebral stroke is a medical emergency and requires immediate attention. It is essential to determine if a stroke is ischemic or hemorrhagic before attempting treatment. This is because certain drugs are used for the treatment of ischemic stroke, such as blood thinners, and may critically aggravate bleeding in hemorrhagic stroke. For ischemic stroke, emergency treatment aims to restore blood flow by reminding blood clots. Medications such as aspirin and tissue plasminogen activators (TPA) are usually the first option. TPA may be given intravenously or, in the case the symptoms have advanced, delivered directly to the brain via a catheter inserted through an artery at the gyron. Blood clots may also be removed mechanically by a special device delivered through a catheter. Emergency treatment for hemorrhagic stroke, on the other hand, aims to stop bleeding, reduce blood pressure, and prevent vasospasm and seizures. These goals are usually achieved by a variety of drugs. If the bleeding is significant, surgery may be required to drain the blood and reduce intracranial pressure. Preventive treatment for stroke includes removal of cholesterol plaque in a carotid artery that supply the brain, widening of narrowing carotid arteries with a balloon, and sometimes a stent. This is usually done with a catheter inserted at the gyron. Various procedures to prevent rupturing of brain aneurysm, such as clipping and embolization. Removal of embolization of vascular malformation, bypassing the problematic artery. So that's it for today's video. Thanks for being the part of the therapy kingdom. See you in the next one. Don't forget to like, comment and subscribe for more content.